So since we've just talked about all these hormones and supplements that are helpful in maintaining or elevating natural hormone levels, I think it's appropriate we talk a little bit about steroid use. Obviously, as you know, like we said before, a lot of athletes manipulate their muscle growth by using anabolic steroids. And obviously this is really not a good thing to do because there are many negative consequences for the body. So heart health, there's a risk of having high cholesterol, increased blood pressure, as well as blood clots. Liver health can also be a problem. Liver just doesn't function optimally anymore. There's increased risk of liver toxicity, and we know that using anabolic steroids also increases your risk of developing tumors within the liver. So really not a good thing. Mood disorders also become a problem. A lot of people taking high testosterone also find that they have a lot of depression and aggression. So, if you've already got somebody who is struggling depression or something like that, adding in extra anabolic steroids can actually be a major obstacle for their mental health. Immunity is definitely decreased with steroid use, and skin health also, because people develop acne and stretch marks. And then there are obviously reproductive concerns as well. In men, gynecomastia, which is the development of breasts, can occur, and testicular atrophy as well. And then obviously for women, there are many virilizing effects, so facial hair, deepening of voice. So obviously we don't advocate steroid use, but we do need to help consumers and patients who are taking steroids because their health is obviously really important. And one of the ways we can do that is to help them with preventing a dominance of estrogen in their bodies, because what happens is when you have too much testosterone, that excess testosterone is actually converted in your body to estrogen, or a form of estrogen called estradiol, using an enzyme called aromatase. So this enzyme is actually found within the testes, the ovaries, the brain, fat tissues, all over the body really. And so any excess of testosterone that it picks up, it will ultimately convert this into estrogen. So what we can actually do for people is we can give them supplements that actually help to inhibit the action of this enzyme, thereby slowing down the conversion of testosterone into estrogen. So there we're looking at supplements like resveratrol, quercetin, genistein, which we find in our PM Phytogen product, as well as green tea. So obviously the liver is going to take tremendous strain with anybody taking in artificial testosterones, and so we really need to support liver function. So taking something like methionine really helps in anabolic steroid users, because it actually helps to remove estrogen by deactivating it using methylation. So this process also helps to with the excretion of estrogen via conjugation. And then also taking something like milk thistle, which increases bile production, will also help to eliminate estrogen from the body, because estrogen relies on bile to be exported out of the body. So milk thistle and methionine then become quite important supplements for anybody really who's looking to support their livers or their liver health, but particularly for bodybuilders using anabolic steroids or athletes using anabolic steroids.